We're going to get ready for our second session. Thank you, Dr. Law. Rebecca, oh, wait a minute. Questions and answers. I'm sorry. Sit down, Bishop Adams and Rebecca. Bishop, sit down. I forgot the questions.
She bosses all of us around.
You hear Dr. Law saying I boss them around. It's not bossing you around. It's direction, because Cornelia directs me. Okay, do we have questions for our panel? Yes, ma'am. The question was, if you feel you're vulnerable and you want to know whether or not you're at risk for getting this disease, where do you go to get one? I have an answer, but I'm going to give it to Dr. Law first. I'm going to say that I'm a primary care doctor, and the first place you should start is your primary care doctor. Dr. Law.
Well, you can get one of those assessments done by me or another qualified neurologist, but no sane person would do that to you. If, as of today, if you have no cognitive symptoms, if you have no memory loss or symptoms, I'm not going to do that test because even though in individuals who have mild symptoms, we know what the impact of that test result is. I can say with a high degree of confidence, if the result is X, it means Y. If the result is A, it means B. But in somebody who's asymptomatic, potentially in that 20 or 30 year span of preclinical disease, I have no tool currently to predict when you're going to develop symptoms. Is it going to be in 5 years, 10 years, or 20 years? If you're 75 years old and you're not going to develop symptoms for 20 years, you want me to leave you the heck alone. And so that is a critical question that we're working very hard right now to try and find better tools for that. The world will change. In a couple of years, you'll remember that I said the world is going to change here very soon, because as soon as one of these treatments proves themselves to be effective in delaying the progression of disease, we're all going to be clamoring for it. And so we need to move quickly to find better tools to predict who's going to be the right person to treat with these things.
Yes, ma'am. Yes. The question was, does taking a sleep aid like Ambien precipitate Alzheimer's or make it happen?
Nope. But don't overdo it.
Don't overdo it. Yes, sir.
I was intrigued by what you were saying about the amyloid plaques and the neurofibrillary tangles, but unfortunately I don't really know what those are. Could you kind of give us a little bit of an explanation and tell us what the antibody treatment might entail?
The question is, what's amyloid or amyloid antibody and tau?
So I get yelled at if I put too much science into my slides, so I had to, but those are excellent questions. And those two things that you mentioned specifically, the amyloid and amyloid plaques, are accumulations of an abnormal protein that deposits in the brains of individuals with Alzheimer's disease. And the neurofibrillary tangles are abnormal clumps of proteins that accumulate inside brain cells, and both of those, we believe, have a toxic effect on the brain. We don't see that in other conditions. So somebody who has memory problems or dementia due to strokes, for instance, wouldn't necessarily have those changes. So it's a very specific pathology that's been known to be associated with Alzheimer's disease since Alzheimer described this condition back in the early 1900s. And the antibodies, and there are in fact antibodies, so antibodies are things that are normally made in our bodies in response to infection, but it's also the basis of vaccines. So when you get a Pneumovax, or you get zoster vaccine, or you get your flu shot, what we're doing is we're stimulating our immune systems to make antibodies and to react against these things. And so a lot of drugs these days are based on that antibody technology, and we can create antibodies to target certain things. And the antibody approaches are using antibodies that are targeting the amyloid, That's the majority of what's being developed by Big Pharma right now. But there's also a study that's starting up right now using anti-tau antibodies. So we're using these treatments to clear away what we know is present in the brains of Alzheimer's patients. And in fact, we know that it works. We can clear that stuff out of the brain. And the slide that I showed you from the recent study clearly shows that in a large number of living people as well. The problem is that we have to hit those things early enough.
Okay, question up there?
Yes, sir. I'd like to know, in relation to traumatic brain injury, how significant is that type of injury for Alzheimer's?
The question is, how significant is chronic traumatic brain injury for the development of Alzheimer's?
Well, it's a hard thing to quantify, partly because traumatic brain injury can cause a number of different things to happen. The thing that's been in the news a lot, having to do with repeated concussions in athletes, is a slightly different condition it's a very different condition than Alzheimer's disease. There's an older condition that used to be called dementia pugilistica, which we saw in boxers, and in fact, those people are also being referred to as chronic traumatic encephalopathy now. And we know that when you have repeated brain injuries like that, severe traumas, it can cause damage and it can cause degeneration of parts of the brain. And so when a young person, when a 40-year-old former football player kills himself and has had all kinds of unusual symptoms, that's pretty clear that that's not normal, and it's most likely that that's going to be related to CTE, chronic traumatic encephalopathy. What's less clear is how much of an impact a history of traumatic brain injury has on your risk of developing Alzheimer's disease 50 years down the road, and that's a much harder thing to quantify. Best advice is don't do it. Don't bang your head. Don't get an IED exploded under you, and don't get concussions.
We have 1 minute and one question left, and I'm going to direct this one, comes from the audience, to Mr. Lewis. The question is, how can we participate in your classes?
Right now I'm on tour doing the chair aerobics, making people more aware of what they can do in their chair and simple exercises in the pool. So I'm going into the video world. So I'm just going from state to state, country to country, and soon to be going to Africa soon and Asia. So you'll see me in the video world soon. But I will have my information out at the next session. I hope to put it up at 10:50.
Okay. All right. Thank you. Session 1 panelists.